Welcome to our presentation, Understanding Dementia and Brain Health. My name is Padma Genesh and I am the Learning Specialist at the Alzheimer Society of Calgary. In today's presentation, we are going to talk about dementia, behavior changes associated with dementia, and brain health. The first segment of this presentation is on dementia. So we'll be talking about what exactly is dementia, what are the different types of dementia, and what are the signs and symptoms. In the second segment, I'll be talking about some behavior changes that are associated with dementia and how to appropriately respond to them. In the third segment, I'll be talking about brain health and risk reduction. Why should we learn about dementia? The numbers on the screen will tell you why. Currently, there are approximately 564,000 Canadians diagnosed with dementia. This is just the number of people who are living with a diagnosis. There are several more who do not have a diagnosis yet but are experiencing the symptoms. And the actual number of people impacted by dementia is actually much higher than the 564,000. It's believed that for every individual who is diagnosed with dementia, there are at least 10 to 12 people around them who are actually impacted by the disease. If you thought that dementia is a disease that affects the very old, that is not correct. 5 to 10% of individuals living with a diagnosis of dementia are under the age of 65. Right here in Calgary, there are approximately 13,000 individuals living with a diagnosis of dementia. Age seems to be an important risk factor for dementia. What we see is that at the age of 65, 1 in 11 people can be diagnosed with dementia, whereas when we go up to the age of 80 and above, 1 in 3 people can have dementia. Dementia seems to be a disease that disproportionately affects women in comparison with men. The lifetime risk of developing dementia happens to be 1 in 5 among women, whereas it is 1 in 10 among men. So what exactly is dementia? Dementia refers to progressive general decline in mental ability that is sufficiently severe to interfere with daily life. Mental ability refers to several elements. It includes ability to remember, ability to learn, ability to think, ability to make decisions, ability to carry on with the activities of daily living, ability to communicate, and so on. Therefore, dementia is an umbrella term that refers to progressive difficulty in all these areas. So we have the dementia umbrella, and below the dementia umbrella are all the symptoms that are commonly associated with dementia. The most common presenting symptom of dementia is memory loss. And this memory loss is very unique. It refers to memory loss of recent events, recently acquired information, and so on. Therefore, a person with dementia might be able to remember things from their past very clearly, but may not remember whether they had a meal or not, and what did they exactly have at that meal, or they might forget a recent conversation. So in this way, it is different from the memory loss that is associated with normal aging. As part of growing older, a person might forget some information here and there. For example, if there was an appointment, the person would remember the appointment but might forget a few details here and there. Whereas in the case of someone with dementia, they would forget the event altogether. So that is a way in which the memory loss associated with dementia is different from the memory loss associated with normal aging. Another common symptom associated with dementia is impaired judgment and reasoning. This simply means difficulty making decisions on a daily basis. It could be as simple as not knowing how to dress for the weather. For example, on a cold, snowy day, a person with dementia might just walk out in their indoor clothes. Or it could be more complex, as having difficulty making the right decision when there are several choices available. So, for example, when a person with dementia goes to a restaurant, whereas previously he or she used to make her own decision about what to eat, now that the person has dementia, the person gets confused and overwhelmed by the variety of choices and is unable to make a decision and would ask someone else to make that decision for them. Another common symptom associated with dementia is communication difficulties. And this includes difficulty expressing oneself and difficulty understanding what another person is telling. And what we have observed in a multicultural society like Calgary is that immigrants who have learned English language at a later stage in their life are more likely to forget English vocabulary when they develop dementia, and they are very likely to revert back to their mother tongue. Another common symptom associated with dementia is visuospatial impairment. It includes two components: difficulty with visual perception and difficulty understanding the spatial distribution of objects. Talking about difficulty with visual perception, even though we are seeing with our eyes, it's actually a part of the brain in the back of the brain called the occipital lobe that processes all the visual signals. So a person with dementia might have difficulty recognizing what they are actually seeing. For example, if there is a dark shadow on the ground, a person with dementia might think that it is a deep, dark hole and might refuse to step on that area. Or if the floor is too shiny, the person might think that it is a wet floor and they would refuse to walk there. Also, in conditions where there is a lack of contrast, a person with dementia could have difficulty recognizing objects. For example, if there is a white toilet against a white wall, a person with dementia might have difficulty recognizing the toilet and might have, therefore, difficulty using the washroom. Talking about the spatial distribution of objects, a person with dementia could have difficulty assessing distances and depths. So, for example, if the person is continuing to drive, they would have difficulty recognizing the distances, assessing the distances between vehicles, and therefore unable to change lanes in a safe manner. Or when the person with dementia is going down the stairs, they would have difficulty assessing the distance that is separating the steps and therefore experience severe difficulty in going down the stairs. Another common symptom associated with dementia is changes in mood and behavior. Now, we all have changes in mood. How is our mood change different from the mood change experienced by someone with dementia? A person with dementia can have rapid mood swings without any reason. And also, they are less likely to have control over their mood change, whereas we can control our emotions to some extent. Dementia is also associated with several behavior changes. In the initial stages, majority of individuals have some insight about the changes that is happening to them, that they are forgetting things, they are not able to make right decisions, they are making a lot of mistakes, and this can make the person actually very anxious, irritable, frustrated, and even afraid. But as the disease progresses, majority of individuals lose insight about what is exactly happening to them. And we would see several other behavior changes surfacing from that point. And these behavior changes include aggression, frustration, sleep disturbances, refusing to bathe, refusing to eat, and so on. Another common symptom associated with dementia is difficulty with day-to-day function. A person with dementia will have increasing difficulty carrying on with the activities of daily life, such as bathing, brushing their teeth, getting dressed, preparing their meals, and so on. So these are the common symptoms that are associated with dementia. when a person has a diagnosis of dementia, they are likely to have at least 3 of these 6 symptoms, and they are likely to be severe enough to impact their daily life. 5% of dementia is actually caused by conditions that can be completely controlled and modified, and they are referred to as the reversible causes of dementia. Some of these causes include medications, particularly a group of medications called anticholinergics. What these medications do is decrease the level of a chemical in the brain called acetylcholine that the brain requires for normal messaging and functioning. So if any of these anticholinergic medications are taken on a high dose for a long period of time, a person is likely to experience symptoms of dementia. But if the medication is stopped in a timely manner, these symptoms go away. These medications include commonly prescribed allergy medications such as Benadryl, a group of antidepressants called tricyclic antidepressants, some bladder control medications, and some sleep medications. Another reversible cause of dementia is nutritional deficiencies. Therefore, dehydration and malnutrition can lead to symptoms of dementia. And when the person starts eating a healthy, balanced diet and starts drinking normal amount of fluids, the symptoms of dementia would go away. Another reversible cause of dementia is vitamin B12 deficiency. And this can be diagnosed by a simple blood test. The level of vitamin B12 in the blood will be low, and this can be corrected by taking vitamin B12 injections or sublingual tablets. Thyroid disease can also cause dementia, and this can be diagnosed again by a simple blood test. The level of thyroid hormone could be either excessively high or too low, and in either case, the condition can be treated with appropriate medications. Normal pressure hydrocephalus is another reversible cause of dementia. This refers to collection of cerebrospinal fluid in cavities of the brain called ventricles. The common symptoms associated with normal pressure hydrocephalus are symptoms of dementia, difficulty walking, and loss of bladder control. If these symptoms are happening around the same time in an individual between the ages of 60 to 80, they are likely to be due to normal pressure hydrocephalus. This is a condition that can be diagnosed by a CT scan. It will show collection of fluid in cavities of the brain, and this can be corrected by removing the extra fluid from the brain by a process called shunting. Another reversible cause of dementia is depression. And depression is a very important cause because untreated depression can increase the risk of dementia by 80%. So we need to be familiar with the common symptoms associated with depression. And these include having very sad thoughts, losing interest in the activities enjoyed before, having difficulty staying asleep, changes in appetite, feeling extremely tired for no reason, and so on. A person with depression could also have feelings of worthlessness and suicidal ideation. The good thing is that depression is a disease that can be controlled with medications. A person can be on an antidepressant that does not belong to the class of tricyclic antidepressants. In that manner, they can decrease their risk of developing dementia. Another reversible cause of dementia is delirium, and delirium refers to sudden change in mental state. Delirium is commonly caused by high fever and common infections such as urinary tract infection, pneumonia, flu, etc. The symptoms associated with delirium include confusion, disorientation, inability to think clearly, inability with decision making, and inability to communicate clearly. A person with delirium can also be aggressive. When these conditions are diagnosed in a timely manner and treated, they can actually reduce the risk of dementia. Therefore, these are the reversible causes of dementia. 95% of dementia is caused by conditions that cannot be controlled or modified. They are called the non-reversible causes of dementia. The most common cause of dementia is Alzheimer's disease. It's believed that 64 to 66% of dementia is caused by Alzheimer's disease. Alzheimer's disease is a physical disease affecting the brain. On the left-hand side, you see a picture of the normal brain. The purple structures are called the nerve cells or neurons. A healthy adult brain weighs 3 pounds and contains 100 billion neurons or nerve cells. Each of these nerve cells makes between 5,000 to 10,000 connections in the brain. So, overall, a healthy adult brain weighs 3 pounds. It's made up of 100 billion neurons and has trillions of connections. We need these many neurons and these many connections to be able to fully function as a healthy individual. These connections and nerve cells ensure that messaging happens very quickly in the brain. On the right-hand side, we see a picture of the Alzheimer's brain. The first change that is observed is abnormal collections of protein called amyloid plaques. These amyloid plaques come from a protein that is normally present in the brain called amyloid precursor protein. This undergoes some alterations and starts depositing in different parts of the brain as a sticky, gooey plaque. What the plaque does is actually slow down the communication that is happening between the cells. The plaques also destroy the connections between the cells so that the signals are not able to travel anywhere. They also cause another change to happen inside the nerve cell called the tangles, the neurofibrillary tangles. And these tangles are caused by another protein called tau protein, which forms part of a vital transport system in the brain. And when the tangles are formed, the transport system breaks down and the cell with the tangle ultimately dies because it is deprived of nutrients that it needs to survive and to function. As the disease progresses, there will be more and more of amyloid plaques slowing down the brain, destroying the connections, and more of tangles destroying the nerve cells one by one. And as these nerve cells die, the brain starts shrinking. This is a very slow disease. It's believed that the plaques and tangles start developing the brain 15 to 20 years before a person experiences the first symptom of memory loss. And by the time a person is diagnosed with dementia, they usually are well advanced into the disease. There are two types of Alzheimer's disease, familial and sporadic. Familial, as the name implies, is the inherited variety of Alzheimer's disease. It runs in families. It's caused by mutations in 3 chromosomes, chromosome 1, 14 and 21. Of these, the mutation on chromosome 14 that codes for the protein presenilin 1 is supposed to be the most predictive of Alzheimer's disease. Familial Alzheimer's disease usually manifests at an earlier age, before the age of 65, and is more rapidly progressive. Fortunately, only 5% of Alzheimer's disease is familial. 95% of Alzheimer's disease is sporadic, which means that anybody can get the disease. One known risk factor of Alzheimer's disease is advancing age. And as mentioned earlier, as we live longer to the age of 80 and above, 1 in 3 individuals can have the disease. Another component has also been identified for sporadic Alzheimer's disease, and that is genetic mutation on chromosome 19 that codes for a protein called ApoE4. Individuals who have inherited that mutation are more likely to develop the disease compared to their peers. The sporadic variety of Alzheimer's disease usually appears at a later age after the age of 65, and it is more slowly progressive. How do we diagnose dementia? Diagnosis of dementia is based on history, some blood test, imaging, and cognitive assessment. If your physician suspects that you could be developing dementia, several blood tests are ordered, and these include tests to assess anemia, your thyroid function, electrolytes, kidney function, calcium levels, glucose, and vitamin B12. Unfortunately, we do not have a blood test yet for Alzheimer's disease, but a lot of research is progressing in that direction. The next step in the diagnostic process is imaging. CT scan is commonly used as a diagnostic tool. CT scan will help the physician identify any changes that's happening in the brain, such as shrinking in the brain, collection of fluid due to hydrocephalus, or damage caused by a brain tumor. The diagnostic workup also includes an MRI scan, which will show changes associated with vascular dementia or blood vessel changes. It will also show atrophy or shrinking of some vital parts of the brain, such as hippocampus. The workup also includes a special type of PET scan. In fact, there are two types of PET scan available. One is called the PIB PET scan. This is a very expensive PET scan exclusively reserved for research because it uses a radioactive isotope, fluor-beta-PIR. The PIB PET scan can show the amyloid plaques, and that's a way the physician can understand that some brain changes have already started happening. But the diagnostic value of a PIB PET scan is very limited. Why? Because just because someone has amyloid plaques does not mean that they are going on to develop Alzheimer's disease. What actually starts the process is the cascade that proceeds from plaque to the tangles to the destruction of cells and shrinking of the brain. Therefore, the diagnostic value of PIB PET scan is quite limited. What we have available in Calgary is another type of PET scan called FDG PET, and this stands for fluorodeoxyglucose PET scan. What this scan does is assess glucose metabolism in the brain. And what has been seen is that in whichever parts of the brain the nerve cells are dying, the cells are unable to utilize glucose. And therefore, by mapping the glucose utilization in the brain, physicians can find out whether nerve cells are dying in a particular part of the brain or not. And therefore, FDG PET scan has got more diagnostic significance. The diagnostic workup also includes cognitive assessment, and the MoCA test, which is an abbreviation for Montreal Cognitive Assessment Test, is a commonly used cognitive assessment test. This test is used to assess the cognitive functioning in the brain. It assesses several cognitive domains such as memory, verbal recall, executive decision making, ability to recognize patterns, and so on. A MoCA score above 26 is considered healthy, whereas a score below 24 is supposed to be consistent with mild cognitive impairment. Going on to medications for Alzheimer's disease, currently we have 4 medications available: Aricept, Exelon, Remenil, and Ebixa. But the most important thing to remember is that these medications do not cure the disease or slow down the progression of the disease. So you might wonder, what do these medications do? 3 of these medications, Aricept, Exelon, and Remenil, increase the level of a chemical in the brain called acetylcholine. So that is all that these medications do. And they allow the remaining nerve cells to function a little more efficiently. The 4th medication, that is Ebixa, decreases the level of a harmful chemical in the brain called glutamate, which is released in the brain when the nerve cells die. So we see that none of these medications actually target the plaques or the tangles which are responsible for the brain changes associated with Alzheimer's disease. Aricept, Exelon, and Remenil are indicated for mild to moderate disease, whereas Ebixa is intended for the later stages of the disease, and Ebixa is not covered by Alberta Blue Cross. There's a lot of ongoing research happening in this direction of treating Alzheimer's disease. And the two most important research initiatives happening right now are the A4 study, which stands for Anti-Amyloid Antibody Against Alzheimer's Disease. In this trial, we are using an anti-amyloid vaccine, which is supposed to remove amyloid plaques from the brain. Initially, the anti-amyloid vaccine was tried on individuals with a diagnosis of Alzheimer's disease, but the vaccine failed because of the huge amyloid load in the brain. So currently, this medication is tried on individuals who do not have a diagnosis of the disease yet, but they either have genetic mutations that could cause the disease, or they have PET scan evidence of amyloid plaques in the brain. Another significant study that's happening is the BACE inhibitor. BACE inhibitors are medications that reduce the formation of plaques in the brain, whereas anti-amyloid vaccines remove plaques from the brain. BACE inhibitor studies are currently going on in the United States and several parts of the world, and both these trials have showed a lot of success in the initial stages and have entered phase 3 trials. Moving on to other non-reversible types of dementia, the next common type of dementia is vascular dementia. Purely vascular dementia accounts for 13% of dementia. But in reality, several individuals with Alzheimer's disease also have vascular dementia. Vascular dementia is caused by interruption of blood flow to the brain, which causes the nerve cells to die. So vascular dementia can follow a single massive stroke, which affects a large part of the brain, or it could follow a series of tiny strokes, where tiny areas of the brain are affected due to lack of blood flow. The ultimate symptoms of vascular dementia depend on the part of the brain that is affected, but there are several early symptoms that are characteristic of vascular dementia. These include confusion, depression, inability to think clearly, difficulty with decision making, and emotional lability. Vascular dementia is the only preventable type of dementia because it is closely related to our cardiovascular health. Whereas we have no control over the plaques and tangles happening in our brain, this is a dementia that can be completely controlled. Another non-reversible dementia is the Lewy body dementias. Lewy body dementias include dementia with Lewy body and Parkinson's disease dementia. Lewy body dementias is caused by another protein called alpha-synuclein protein that forms inclusion bodies in different parts of the brain. This disease was formally diagnosed by Dr. Frederick Lewy in 1912 and hence gets its name Lewy body dementia. The core symptoms of Lewy body dementias include fluctuating cognition, meaning that the intellectual capabilities fluctuate on a daily basis, so that a person could be highly functioning on a particular day and very poorly functioning on another day. Another common symptom includes visual hallucinations, that is, seeing things that are not there. And the visual hallucinations of Lewy body dementia are unique in that the affected person would see tiny animals, tiny people, and tiny cartoon characters. Another common symptom associated with Lewy body dementia is symptoms of Parkinson's disease, which includes rigidity, shuffling gait, downward gaze, and slow and shuffling movements. Lewy body dementias include, as I mentioned earlier, dementia with Lewy body and Parkinson's disease dementia. Both of them are different presentations of the same disease entity. If the person is presenting with motor symptoms, then they are more likely to be diagnosed as Parkinson's disease dementia. If the dementia symptoms develop after a period of 1 year or more. But if the dementia symptoms and the motor symptoms are happening around the same time or within a span of 1 year, the person is likely to be diagnosed as dementia with Lewy body. Lewy body dementia commonly affects individuals between the ages of 60 and 80, and males are slightly more affected than females. Again, this is an incurable type of dementia. Another interesting variety of non-reversible dementia is frontotemporal lobe dementia. In this particular type of dementia, nerve cells are dying in two particular parts of the brain, that is the frontal lobe in front and the temporal lobe on the side. The frontal lobe is called the executive center of the brain, and it's responsible for functions such as planning, organizing, decision making, initiative, personality, and social skills. The temporal lobe is the seat of memory and language. So when nerve cells are dying in these two parts of the brain, the person can exhibit difficulty in all these areas. There are three different presentations of frontotemporal lobe dementia. One type is the behavioral variant, where the person presents with change in personality, difficulty with decision making, and loss of inhibitions leading to inappropriate behavior. The second common variety of frontotemporal lobe dementia is a language variant, where the main part of the brain affected is the temporal lobe, and the person could present either with difficulty finding words and being non-fluent, or being very fluent but making no sense. Third variety of frontotemporal lobe dementia is the one associated with motor neuron disease. 10 to 15% of people with frontotemporal lobe dementia can develop motor neuron disease, where they develop progressive paralysis and weakening of vital muscles. So the person could experience difficulty swallowing, they could have difficulty getting in and out of a car, going up and down the stairs. So difficulty with movement is possible, and the disease progresses with development of respiratory paralysis. But fortunately, only 10 to 15% of people with frontotemporal lobe dementia go down that route. Frontotemporal lobe dementia usually affects younger people between the ages of 40 and 70. Another common variety of dementia is the mixed dementia, and this refers to a condition where the person has more than one type of dementia. The common mix is vascular dementia. So it's possible for a person with Alzheimer's disease to have vascular dementia, or someone with Lewy body dementia to have vascular dementia. This makes the diagnosis as well as treatment extremely challenging. Then there is another small category that's called other types of dementia. This includes the rare types of dementia such as Korsakoff syndrome, which is caused by vitamin B1 or thiamine deficiency. There is also Down syndrome dementia, multiple system atrophy, MSA, CJD, that's called Creutzfeldt-Jakob disease, and CTE, which is a dementia that is associated with head injury and common among hockey players, boxers, and football players. All these types of dementia are very rare. That concludes our segment on understanding dementia. Let's now move on to behavior segment. Dementia can be associated with several behavior changes. In the initial stages, the majority of individuals do have an understanding of the changes that's happening to them. The memory loss, the confusion, and the number of incidents they are making mistakes, all of those lead to anxiety, irritability, frustration, and even symptoms of depression. As the disease progresses, several other behavior changes begin to surface, and these include anger, agitation, aggression, general emotional disturbances, getting easily frustrated, inappropriate behavior, which could be verbal or physical or verbal outburst, restlessness, pacing, hallucinations, where a person sees things that do not really exist, or having delusions, where a person could have strong belief about something which is false. Other behaviors include having sleep disturbances and getting extremely agitated towards sunset, which is commonly referred to as sundowning symptoms. What impacts a family much more than the memory loss associated with dementia is actually the behavior changes and the personality changes. Now, we believe that every behavior actually has a meaning. It could be the way that the person is trying to communicate that something is just not right. And every action that is performed by a person with dementia does have some meaning. So when we see a behavior change, the best thing to do is actually to take a step back and try to find out where this behavior is coming from or what exactly is causing this behavior. Some triggers for behavior changes include health or medical causes, such as discomfort from medications or discomfort from medication interactions, pain anywhere in the body. Especially pain, what is seen is that individuals with dementia have difficulty expressing pain and pain goes untreated. So, pain anywhere in the body can be a trigger for behavior change. Delirium, that is arising from infections, can be another medical cause that leads to behavior changes. Impaired vision and impaired hearing can also trigger behavior changes. Behavior changes could also be due to an unmet need, which could be a physical need such as hunger, thirst, or it could be that the person is feeling too cold or too hot, or even the lack of meaningful engagement as being too bored and having nothing meaningful to do. Even missing a family member and feeling lonely can also lead to behavior changes. Changes in the environment can be a trigger for behavior changes, and these include lighting. Is the light too bright or is it too dark and the person is seeing shadows that is scaring them? The temperature around them, is it too hot or too cold? That could trigger a behavior change. Any unfamiliar faces, like new staff members in a care facility, could be a trigger for behavior changes. Having unfamiliar people or crowd could be a trigger for behavior change. And new challenges in the environment, such as moving the furniture around or a new set of stairs, could be a trigger for a behavior change. Last but not the least, the way we interact with the individual with dementia can also trigger behavior changes. Our approach and our attitude. How are we communicating with the individual with dementia? Are we correcting too much? Are we arguing? Are we bringing them back to our reality rather than playing along with their reality? Are we asking them or forcing them to do things that they really don't want to do? All these interactions can be important triggers for behavior changes. So when you encounter a behavior change in a loved one with dementia, it's good to take a step back and think about what is causing this behavior change. It all begins with actually observing the behavior. What is the person saying? What is the person doing? What is the emotion that is expressed? Then you make a decision as to whether you need to interfere or not. There are two conditions where a behavior has to be addressed. Is the behavior harmful? Is somebody going to get hurt? Or is the behavior escalating with time? These are the two conditions where it's wiser to actually interfere and redirect the person. One way to proceed is actually looking at when is the behavior happening? What are the activities that are leading up to the behavior? What was the conversation going on? Who were the people around? What time of the day did it happen? And what activity was going on at that time? This might help you find a pattern to the behavior And just by changing the situations around, you might be able to prevent that behavior altogether. If that is not possible, the next step would be to look for the possible triggers for the behavior change. Could it be due to a health condition that is not recognized? Then maybe the person needs to be seen by a doctor or a nurse. Could it be due to an unmet need? Try to look for that and try to fulfill that need. Or perhaps the behavior is arising because of changes in the environment, and perhaps we can do something to make the environment a little more friendly for the person. Or maybe it is a way we are interacting with the person, and that is something we can modify and make it more compatible for the person. Here are some general tips that you can follow when you are encountering a behavior change. First of all, reassure and comfort the person. Talk to the person in a calm and reassuring way. Even if you are panicking on the inside, remain in control. It's a good idea to monitor personal comfort and meet any unmet need. Avoid being confrontational and try to avoid arguing, correcting the person, or bringing the person to our own reality. It works best if you can play along and enter their world. Acknowledge requests and try to respond to them. Try to look for reasons behind the behavior and explore the various solutions. Create a calm environment or move the person to a quiet space. It could be that the stimulation in the environment might be causing that behavior change. If you cannot think of any possible triggers that has caused the behavior, it's a very good idea to redirect the person to a favorite topic or a favorite activity. Maybe play their favorite music or give them a drink or a cup of tea or something to distract them. Allow adequate rest between stimulating events. Maybe there's been too many things going on and the person needs a break. It's a good idea to provide a security object. If you see that the behavior is escalating and you could be hurt, take a step back and make sure that you are safe. You can even step out temporarily and have a timeout and come back, and you might see that the behavior has changed already. It's very important to understand that whatever they say and whatever they do is not deliberate or intentional. It is just the disease that is causing it. Therefore, do not take their words or their actions personally, and share whatever you have learned with the care team as well. At the Alzheimer Society of Calgary, we believe in person-centered approach, and we believe that what works best is more hugs and less drugs. So here are some non-medical approaches to behavior changes. Music therapy is supposed to be very beneficial for managing behavior changes, especially if you are playing music that is very familiar. And if that happens to be the person's favorite music too, you will see the remarkable change that happens when you play the person's familiar favorite music. Music can actually bring down anxiety, reduce agitation. It can evoke positive emotions and connect with positive memories. And you will see that the behavior changes are actually decreasing in frequency. Another helpful approach is art therapy. Both creating art as well as appreciating art can be very helpful in managing behaviors. A person can have an increased self-esteem looking at the art that they have created, and this is also a good way to reduce anxiety and agitation and calm the individual. Another helpful therapy is having pets around, pet therapy. And this works especially well for people who are well advanced into the disease and have communication challenges. The unconditional love and companionship provided by pets can be extremely relaxing and comforting for the individual with dementia and can decrease behaviors. So with this, we come to the end of the segment on behavior changes. Now moving on to a segment on brain health and risk reduction. Till a few years ago, it was believed that changes happen in the brain as we age and that nothing can be done about them. But research over the years has shown that our brain is neuroplastic and there are several things that we can actually do to keep our brain healthy as we age. And what has been seen is that whatever is good for the heart is also good for the brain. One of the most important strategies to maintain a healthy brain as we age is to engage in daily physical exercise. No pill has been identified yet that can match the benefits of daily physical activity. What kind of exercise is required? It's moderate intensity physical exercise. And how long do we have to do it? For 150 minutes per week, which can be broken down to half an hour of activity 5 days in a week. Any activity that increases your heart rate and makes you slightly breathless is ideal for maintaining brain health. Exercise not only delays the progression of dementia, but it can also prevent dementia from occurring. The benefits of exercise is that it increases circulation to the brain, delivering more oxygen and nutrients to the brain. It releases endorphins and therefore decreases depression without the use of medications. It can promote sleep. It can also combat age-related shrinking of the brain that happens as we age. This happens because daily physical activity can increase the stimulation of a hormone called brain-derived neurotrophic factor or BDNF that can cause more neurons to be regenerated in critical parts of the brain such as the frontal lobe and the hippocampus. Another important strategy to maintain brain health is staying socially connected. If you're staying socially connected, it will help you stay mentally connected as well. So keep in touch with old friends, make new friends, try new volunteering opportunities, perhaps join a book club or a theatre or the Toastmasters club and so on. What happens when you are socializing is that the neurons that were previously dormant and lying asleep are now being fired, and this helps maintain connections and make new connections in the brain and therefore prevent the loss of connections that happens as we age. Another strategy to maintain a healthy brain is to adopt healthy lifestyle choices. 20 years of research has gone to prove that Mediterranean diet is the most heart healthy and brain healthy diet. It's been found that people living along the Mediterranean coast have very low incidence of heart attack, stroke and dementia, and the secret lies in the diet. The components of Mediterranean diet include fresh fruits and vegetables, whole grains, oily fish, which is a rich source of omega-3, olive oil, which is made up of unsaturated fats and is very beneficial for lowering your unhealthy cholesterol and elevating your healthy cholesterol. However, there is a flip side to the Mediterranean diet. We get the benefit of Mediterranean diet only if we follow it strictly. Every meal has to be Mediterranean. And if you follow a very strict Mediterranean diet, it can decrease your risk of dementia by 55%. But if you loosely follow it, you absolutely get no benefit at all. Another healthy lifestyle to adopt is to quit smoking. Smoking decreases the blood flow to the brain and decreases the delivery of oxygen to the brain. Therefore, we need to quit smoking as early as possible. Adequate sleep is required for maintaining a healthy brain. It's believed that it's during the deep sleep that the nerve cells in your brain become smaller, the spaces between them open up, allowing the cerebrospinal fluid to clear toxins from the brain. Therefore, it's very essential for everybody to have that good quality of deep sleep. How much of sleep do you need? That is very individual. Some individuals do very well on 5 to 6 hours of sleep, whereas others need 8 hours and more. It actually depends on how you are performing the next day. If you are not asleep behind the wheel and you're not sleeping at your desk, you probably are getting a good amount of sleep. Another strategy to adopt is limit alcohol. Alcohol is believed to be a neurotoxin. So if you do consume alcohol, make sure that you are staying within the limits. The permissible amount of alcohol is 1 standard drink for women at one time, which means like 5 ounces of wine at one time. And for men, it is 2 standard drinks at a time, which can be broken down to 10 ounces of wine. And the maximum amount of alcohol allowed in a week is 3 to 5 drinks for women and 5 to 7 drinks for men. Anything beyond that is a neurotoxin and can actually damage your brain. Because of the drawback associated with the Mediterranean diet, researchers have come up with a new diet which is called the MIND diet. MIND diet is a hybrid of the Mediterranean diet and another diet to reduce high blood pressure called the DASH diet. The benefit of MIND diet is that if you're strictly following it, it causes 53% risk reduction. But if you are only moderately sticking with it, it still gives you 35% risk reduction. So it is superior to the Mediterranean diet. The MIND diet includes 10 healthy food groups, which includes berries, green leafy vegetables, other vegetables, whole grains, beans, nuts, oily fish, poultry, olive oil, and wine within permitted limits. While consuming food from these 10 healthy food groups, it's important to avoid food from the 5 unhealthy food groups. And that includes avoiding red meat, butter and margarine, cheese, pastries and sweets, and fried and fast food. Seafood is found to be extremely beneficial for brain health, especially for individuals who carry the genetic mutations for the sporadic variety of Alzheimer's disease, namely the ApoE4. Vitamin D deficiency is found to increase the risk of Alzheimer's disease and other types of dementia. So it's extremely important to make sure that we take at least 1,000 international units of vitamin D on a daily basis. Another strategy to improve brain health is to stimulate the brain. While exercising the body is important, exercising the brain is also important for brain health. And what cognitive stimulation actually does is increase what is called the cognitive reserve of the brain. Cognitive reserve refers to the extra protection against Alzheimer's disease that we get by being in school for an extended period of time or by engaging in occupations that use a lot of your brain power. Ways to stimulate the brain include doing puzzles, learning new skills, learning anything new, a new hobby, a new language, or even the lyrics of a new song, or enrolling in a course. All these are different ways of stimulating the brain. It's important to remember that we offer the brain a variety of stimulating activities to keep it challenged. Stress is extremely harmful for brain health, so it's very important to identify stressors in our life and take some active steps to reduce stress. Some of the ways that you can reduce stress include doing yoga, tai chi, meditating, playing music or listening to music, engaging in artistic creation, or just simply playing with pets. Whatever works for you, make sure that you spend at least half an hour every day to wind down and thereby relax yourself. Other strategies to improve brain health includes maintaining healthy body weight, blood pressure, cholesterol, and blood sugar in the normal range. It's believed that obesity, hypertension or high blood pressure, diabetes, and high cholesterol are all factors that increase the risk of dementia. Just having diabetes increases the risk of dementia by 20%. And if that is combined with depression, your risk increases to 117%. So if you have any of these conditions, it's extremely important to consult your doctor and make sure that you are taking the right medications and staying physically active. Another strategy is to prevent falls. Falls can increase the risk of developing dementia as we age. So, if you are walking outside during winter, avoid icy, slippery sidewalks. Keep your home clutter-free. Make sure that there are no loose rugs, no loose handrails, and that there is enough lighting throughout the house. You can also improve your stability by doing balancing exercises in the very comfort of your own home. And when you are biking, please wear a helmet and make sure that you are protecting your head. The diagram on the right shows you all the strategies for brain health that we have discussed so far. Research has shown that if you are engaging in just one of these strategies, it gives you around 5 to 15% of benefit. On the other hand, if you are including more and more of these strategies in your daily life, then you can get anywhere from 25 to 150% risk reduction. To conclude, an active, healthy lifestyle can help in decreasing our risk of dementia as we age. If you need more information on any of these, please visit our website alzheimercalgary.ca. Thank you for your time. Currently, there is no blood test that is specific for Alzheimer's disease, but a lot of research is going on in that direction. And research is happening in United States, United Kingdom, and right here in Calgary, University of Calgary is also engaged in developing a blood test. If you think that you have a high risk of developing Alzheimer's disease, that's you have several members in your family being affected with the disease and a strong family history, it's a good idea to talk to your doctor about it, and your physician can arrange for a test. If you're really concerned about her symptoms, what you can do is actually journal them, document them, and then take an appointment with her physician. Ask for a long appointment and then take these the documents that you have with you and have it placed in her file. And this way the physician cannot refuse but proceed with more investigations and workup. No, but they can be seen on a new type of PET scan called the PIB PET scan. But currently it is reserved exclusively for research. And they also, if you think about it, the diagnostic value of the PET scan is actually very limited. Unfortunately, there is no pill or vaccine you can take to prevent Alzheimer's disease, but a lot of research is going on in that direction. At one point of time, there was that concern that using statins to reduce cholesterol can actually increase your risk of dementia. But research done has proved that that is not true anymore. So if you do have a high level of cholesterol, it's sensible to take statins, and it will not increase your risk of developing dementia. At this point, we do not have enough research evidence to say that coconut oil is beneficial and can prevent or cure dementia, but we just have to wait and see. One way to get your dad's physician take these symptoms seriously is by actually writing it down, documenting what are the symptoms you are seeing, how frequently you are seeing them, and take it to the physician and suggest that he keeps it on file. If he is still refusing to act on these symptoms, then you can contact the Calgary Geriatric Assessment Center and they will help you proceed with the testing. Yes, it's definitely important to know the exact diagnosis, because some of the medications available to treat the different types of dementia, they are all unique, or they are intended for that particular variety of dementia. For instance, if you take some psychotropic medications that are sometimes prescribed for people with Alzheimer's disease, it can be very fatal for somebody with Lewy body dementia or frontotemporal lobe dementia. So therefore, it's very important to know the exact type of dementia. Actually, vitamin D is very beneficial for brain health. So, especially living in Calgary, it's a good idea to take vitamin D on a daily basis, at least 1,000 international units of vitamin D. Other than that, it maybe makes more sense to stick with a healthy diet, such as a Mediterranean diet or a Mayan diet that is plant-based and includes whole grains and oily fish and olive oil, things like that. MCI stands for mild cognitive impairment. A person is said to have MCI when they are experiencing some symptoms, but they are not severe enough to be diagnosed as dementia. And this is the critical stage, very crucial stage, when we can intervene and do something to delay the progression to dementia. And how you can achieve that is by engaging in an active, healthy lifestyle. It gives time for the family to plan things for the future. That's one thing. And secondly, it also allows families to access programs and services that can improve the quality of their life. And thirdly, the individual also gets an opportunity to participate in clinical trials and maybe even get things in their bucket list accomplished.